Dear friends, ecumenical accompaniers and colleagues who have gathered here in Bangkok to attend the Asia Regional Consultation, which is being organized by the Christian Conference of Asia. I take this opportunity to welcome each and every one of you. As I am away on travel these days outside of Thailand, I am unable to be present in your midst. However, this is an opportunity for me to officially greet you and welcome as the General Secretary of the Christian Conference of Asia to the significant events initiated by CCA, which focuses on the theme, Let Communities Lead, Faith Perspectives to HIV Response. The Christian Conference of Asia, which represents the Asian ecumenical fraternity, covering a large geographical region starting from Iran in West Asia to Japan in East Asia, and from Nepal in the north to New Zealand in the south, offer this platform and this opportunity for you all to come together and reflect on our common and collective task of being accompaniers and facilitators in our common goal of inspiring and motivating the people and communities to achieve a shared vision of zero new HIV infections, zero discrimination, and zero AIDS-related deaths in this world. The Christian Conference of Asia, through its special program, ATCHAA has initiated numerous innovative programs and activities during the past several years with an aim to combat the increasing threat to humanity, the widespread of the HIV and AIDS. Even though the Asia region has advanced tremendously in the economic and social arena during the past few decades, several Asian countries are still affected with health-related problems, resulting in deterioration of health conditions of millions of people, even amidst these economic or social advancements and progress. The prevalence of these hazardous health problems causing high rates of morbidity and mortality in any society is a common phenomenon. The lack of skilled health personnel, the lack of adequate infrastructure facilities in hospitals and primary health centers, and the lack of the much needed financial and human resources for providing healthcare are impediments to provide proper healthcare systems. All these are reasons for actually adding discredits in any civilized society. The number of deaths due to non-communicable diseases is on the rise, and the occurrence of communicable diseases, in especially the infectious diseases, these are rampant now. The number of deaths due to HIV and AIDS, this has become a serious public health challenge. And the explosive nature of HIV and AIDS warrants urgent attention and action that are needed to combat this growing menace in several Asian countries these days. Asia region is home to an estimated 6.5 million people living with HIV, and another 300,000 new infections were identified in the year 2022, according to the reports published by the UNAIDS in 2023. 3/4 of these infections occurred among the key populations. Various reasons can be identified for this alarming trend in Asia, which will be discussed in the coming days in different sessions. During these problems that are occurring, people who are living with and affected by HIV continue to experience stigma and also discrimination. Stigma and discrimination prevailing among people are critical factors for addressing the problem at the national and regional levels, especially developing systematic public health policies to prevent the spread of HIV and AIDS in Asia. Asia faces multiple and complex hitches in developing and following effective measures to address this growing HIV and AIDS problem. Poverty, low literacy rates, outbound migration, tourism, poor infrastructure in providing healthcare systems or developing healthcare systems, population size in different countries, and social and cultural values are hindering the efforts to develop effective responses to combat HIV and AIDS. It is in this context that the role of all sections in our societies, especially the faith-based organizations, need to strengthen their efforts to prevent the growing trend of this HIV and AIDS problem. Religion, we know that is a key element of community organizations and social structure. It is in many societies worldwide. In the Asian context too, a vast number of people identify themselves as members of a faith community. Their faith shapes their attitudes, their perceptions of themselves, and also about others. And also their faiths, conditions, how they respond to their neighbors and affects how they interact with people living with the HIV in their society. The majority of whom are themselves members of faith communities. CCA, through its close links and associations with the faith-based organizations in Asia, realized the fact that the faith-based organizations have potentials in developing a comprehensive response to address this problem of HIV and AIDS. And they have these capacities at the national level, regional level, and also at the global level. Cooperation and networking among various actors such as religious organizations, faith-based organizations, civil society movements, women's organizations, and other networks. This can be engaged in building capacities of people and communities who are engaged and who can be engaged in combating or arresting HIV and AIDS in our societies. CCA's own experiences have proved that effective networks and partnerships are potent forces in HIV, AIDS advocacy and awareness building efforts. Historically and traditionally, churches across the world have been demonstrating their role in health and healing ministry. The church-related hospitals and healthcare missions of the churches have been offering comprehensive healthcare to everyone in society by way of providing healthcare services in manifold ways, including providing counseling services. And also, the churches have been emphasizing the spiritual dimension of healing. However, several of our Christian institutions these days are not demonstrating their leadership in addressing the vulnerable situations related to HIV and AIDS affected people due to cultural factors or the social stigma exists in their societies. In this context, The Christian Conference of Asia has been trying to sensitize and educate its constituencies about the challenges posed by the pandemic, the changing paradigms in health and healing, and the role of churches in complementing governmental and civil society efforts, especially in providing proper attention to address these problems. This has been the concerns of the Christian Conference of Asia that is being promoted through its different programs, mainly to sensitize and educate and equip the CCA's member constituencies in Asia. The CCA, through its special program, the Action Together in Combating HIV and AIDS in Asia, through this program, CCA has been engaged in equipping its member churches and councils to respond effectively to HIV and AIDS issues. Various programs at different national and sub-regional levels initiated by CCA in the past proved the fact that there is a need, an urgent need for building more capacities in order to help the churches to be engaged in a mission of combating HIV and AIDS. This regional consultation is another effort of CCA to explore the possibilities or to explore how churches can effectively contribute to health and healing ministry in the context of HIV and AIDS and ensure that communities lead the action with the churches and church-based organizations. We do believe that this consultation will help to reach the goal and targets of evolving a relevant contextual theological understanding in health and healing ministry, which will also help for identifying common strategies for awareness building and advocacy in responding to HIV and AIDS, including prevention, promotion of health, reduce the stigma and discrimination, and also enhance care and support. Friends, let us work together, reflect together, and find ways and means to strengthen our common goal and commitments as part of our Christian faith and witness. Let us be instruments in God's hands in inspiring and motivating the people and communities to achieve a shared vision of zero new HIV infections, zero discrimination, and zero AIDS-related deaths in this world. Once again, I welcome you all to this special event. May God continue to bless us all. Thank you very much. Thank you.